Validation therapy is an approach that involves validating or accepting the values, beliefs, and reality of the person with dementia to reduce stress and provide opportunities for the individual to communicate his or her feelings. This therapy does not require the use of any stimuli. It is focused on a communication style that will reduce agitation and problematic behaviors. Naomi Feil, who is the creator of validation therapy, recommends that it is used with, as she describes it, disoriented, very old people. Research on this population has been done on adults over the age of 80, so it is recommended that validation therapy is used with older adults, typically over the age of 80. In terms of dementia type, this treatment was originally designed for older adults who were not oriented, either described as maloriented or disoriented adults. Naomi Feil later expanded this therapy to include people with Alzheimer's type dementia. Research has been done with people who have cognitive impairment, moderate to severe dementia, and people with moderate to severe Alzheimer's type dementia. With this in mind, Feil describes the 4 stages that disoriented people pass through and the specific techniques that need to be applied by the therapist at each of these stages.
Stage 1 is described as malorientation, which is characterized by confabulation and self-defensive behavior. This can include hoarding behaviors, blaming others, and stealing items of strong personal value from others. Therapists can help by listening empathetically. They can use non-threatening questions such as what, when, how, and who, but it is best to avoid questions that begin with why because they require more complex cognitive reasoning and can also be perceived as threatening by the patient. Also, you should use repetition and repeat back what the person with dementia has said. Finally, it's helpful to use opposite imagery to help the person focus on positive thoughts. Help them imagine the opposite of the situation they are currently threatened by. It should be noted that validation therapy is not recommended when the person with dementia is having delusions, which causes them distress.
This is mine. This is my wallet.
It is your wallet.
My neighbor is always trying to steal things from me. All the time. I see her, she's always sneaking into my room and she's trying to steal my things, and she tried to steal my wallet and it is mine.
Who tried to steal it?
My horrible neighbor next door who's always coming in and she's trying to steal things from me.
Oh, when did she try to steal it?
She tried to steal it from me.
Well, she seems like a really nice lady. I wonder if maybe she wants to share it.
No, she's always trying to steal.
What else has she tried to steal?
I don't know.
Well, she just seems like a really nice lady. I don't know if she, I wonder if she wants to share. And you're really nice too. Do you think you might be willing to share with her the next time she wants to steal?
Yes, I could share it.
So what could you say next time that happens?
I could maybe share it with her sometime.
Okay.
Stage 2 is described as time confusion, which is characterized by a lack of awareness of the time of day, the month, the year, or the season, and increased impairments in recent memory. These patients can jump back 60 years in a second. Therapists can help by using touch liberally because people in stage 2 will find touch comforting and not threatening like they would in stage 1. They can also use close eye contact in combination with touch, clear voice, and using simple language. This will help stimulate verbal and nonverbal communication. matching the emotion that the resident is feeling with memories of a time in their life when they experienced the same emotion. It is important to validate the feelings that the person with dementia is exhibiting. However, this can be confusing at times. Therapists should use ambiguous questions when trying to maintain contact. This can be done by using unclear reference, such as it, him, or she.
I need to go. I need to go get my kids from school right now. It's time to go get them. I have to go pick them up from school. I have to go.
They're riding the bus home today, so you need to be here when they get home.
Oh. Okay.
While we're waiting, why don't you tell me about your kids? I haven't heard about them before. What about your oldest kid?
Oh, my
A
oldest.
boy or a girl?
My oldest is a boy.
Oh, what's his name?
His name is Daniel.
Oh, I love that name. I'm sure Daniel's looking forward to seeing you this afternoon when he gets home from school. Do you have any other kids besides Daniel?
I have a girl. Her name's Caroline.
Oh, that's a beautiful name. Oh, Daniel and Caroline. Very nice. Well, I'm sure they are really excited to come and see you this afternoon and get home from school.
Stage 3 is characterized by repetitive motion, such as self-stimulating movements and vocalizations. At this stage, the person with dementia has less social contact and can retreat inward even further. They will not exhibit any purposeful verbal or nonverbal communication with others. Therapists can help by genuinely mirroring the repetitive movements of the person with dementia to establish a meaningful relationship. The therapist needs to try and link these repetitive movements to their basic human needs. For example, a patient might shout because they need to be heard and find meaningful connection with someone else. Therapists can use music and movements that are culturally meaningful to the patient. The songs must be familiar to the patient and linked to strong emotional memories.
Stage 4 is called the vegetative stage. This stage is characterized by minimal movement, with the patient's eyes closed most of the time. The repetitive movements, as seen in stage 3, have stopped. Music and touch may spontaneously trigger some verbal or nonverbal responses, but it is often too late to expect proper speech or purposeful responses. Therapists can help by touching the patients and playing meaningful music for them, much like the type of help they can give in stage 3.
I'm gonna let it shine, this little light of mine. I'm gonna let it shine, this little light of mine.